Ishan GOYAL, please take up the next stage, please.
Good afternoon, everyone. My name is Dr. Ishan GOYAL. I present a case of preeclampsia beyond blood pressure, exudative RD in pregnancy. So preeclampsia is basically a multisystemic disease with a new onset high blood pressure of more than 140/90, generally accompanied by proteinuria. Now in that, HELP syndrome is characterized by hemolysis, elevated liver enzymes, and low platelet count, while partial HELP syndrome will be either one or two of these. Now, RD generally affects 0.1 to 2% of patients in severe preeclampsia and 0.9% patients in HELP syndrome. So, pathophysiology is similar in HELP syndrome as in DIC. So, where microthrombi cause hypoxia, which causes significant failure of outer blood retinal barrier, which causes formation of a bullous RD. Now, we present a case of a 26-year-old primary gravida at around 27 to 28 weeks of period of gestation. She was admitted in the antenatal ward due to generalized throbbing headache, vomiting, swelling of face, arms, feet, and intermittent vertigo since 2 weeks. She is a known case of hypertension. She was detected at 15 to 16 weeks of period of gestation and was started on nifedipine 10 mg. Now, after admission, she complained of sudden onset, painless diminution of vision since 1 to 2 days. On bedside examination, we examined bedside initially, and then she visited our clinic. So uncorrected was counting fingers 2 meter in the right eye, and uncorrected vision is counting finger 2 meter at right eye, and left eye 6/36, while pinhole showed no improvement. Pupils were sluggishly reactive with increased pupil cycle time of around 980 to 1005 milliseconds in the right eye and 990 to 1015 milliseconds in the left eye. There was no RAPD in either of the eyes. IOP by GAT was 10 and 12, and posterior segment shows large fluid-filled bullae seen in the inferior temporal region involving the macula in the right eye, while left eye the macula was not involved, and shifting fluid sign was positive in both the eyes. And bedside confrontation test shows superior and inferior nasal visual field defect in the right eye and superior visual field defect in the left eye. So this is the fundus image. So we can see fluid filled bullae in both the eyes, while it is involving the macula in the right eye. Left eye macula is spared. That also tells about the better vision. Then coming to investigations, low platelet count, deranged RFT, and increased CRP, SR levels were seen, but LFT was within normal limits. So this was a case of a partial HELP rather than a complete HELP. And then treatment, blood pressure was treated by the obstetrician and the physician, and they were giving IV dexamethasone 6 mg QID for early fetal, because they were anticipating urgent C-section. Subsequently, she was taken for urgent C-section. Now, after 6 days after delivery, we saw the patient again. Now, the RD had resolved by itself, but we can see a macular star kind of formation in the right eye. So, and the vision had improved to 618 in the right eye and 69 in the left eye. Now this is a case of partial HELP syndrome with preeclampsia. Now, as it is a stress-induced condition, definitive treatment is the delivery of the fetus. Aggressive blood pressure control and corticosteroids serve a vital role in supporting the RP pump function, therefore promoting the neurosensory retina reattachment. Now, there are no explicit recommendations for this management, but it is advisable to terminate the pregnancy by cesarean section as soon as possible. Now, anatomical sequelae is usually mild, but the functional sequelae, as for example here, macular star kind of picture we can see, can vary from case to case basis. Thank you.
Thank you very much. One question can be there from the panel, and till that time I'll invite Dr. Manjot Kaur from the previous session to please.
What do you have the long-term follow-up for this?
Sir, she is a very rural background patient. She is lost, but I would like to do an OCT as well as to see whether any functional sequelae are there or not, but she is lost to follow-up.
Do you have post-operative vision after 6 days? What was the vision?
Vision 618 in the right eye and 69 in the left eye, sir. Thank you, sir.